Hello. I want to talk about celiac disease, which is actually a chronic disease of the small intestines. And celiac disease affects more than 1% of United States of America. It is normally misdiagnosed, and majority of the people are diagnosed with irritable bowel or some other form health condition. And they've recently, in the past 10 years, finally have discovered that it is celiac disease. Celiac disease affects the small intestines, and when a person eats gluten, then it causes inflammation of the small intestines. The damage varies, but the symptoms are normally the same. It does vary, but the basic symptoms are general, which can be diarrhea, fatigue, weight loss, bloating, anemia, and at times weight gain, depending on the person. Each person is different, but those are some general symptoms that doctors look for in the very beginning. When the intestinal damage reaches a heavy condition, that's when a gluten-free diet is given or told to the patient, to go ahead and pursue the gluten-free diet. Gluten-free diet, after a diagnosis, means that you don't eat wheat, you don't eat anything with gluten, barley, malt, spelt, rye. Those are all items that are filled with gluten. There are many items that normally people don't even realize that has gluten in them. And I am celiac. I found out in 2009. It took 10 years for them to figure out that's what was wrong with me. So someone suffering with the disease has inflammation of the small intestines. It can be very painful, and it takes a lot of the damage. It causes a lot of damage to the small intestines. Most of the time, the diagnosis and then colonoscopy is 99% of the time, is always not offered, but the procedure is done. So with the celiac disease, it's a very serious health condition, and it can cause a number of symptoms. As I mentioned earlier, with the diarrhea and fatigue and so forth, it also has a lot of negative items that take place within your system, such as the nutrients. You like nutrients. Your nutritional value, you get just a percentage of nutrients. You also have digestive issues. There are many items that you cannot eat any longer. What you might think is an allergy, celiac disease is not an allergy. It's an autoimmune disorder. So what the digestive issues is, because it is that autoimmune disorder and you have digestive issues, things that you might have been able to eat before, you can't eat now. Lactose intolerant, corn, along with those wheat and gluten items, there's a whole list of other items that your body will start rejecting. One of the big items with celiac disease, sorry about that, with celiac disease is if you do not get it caught, you do not take care of it, And when I say that, if you don't follow that gluten-free diet and you don't follow what the doctors tell you, then it can resolve into cancer. There are several different cancers that unfortunately celiac disease can form into. So that's where the colonoscopies come into check, and a normal person might only get them after a certain age. With celiac disease, most of the time, like myself, I might have to get them every 6 months to every year. So it depends on the person and what their situation is. So it's not a set designated time frame for a celiac person. And then there are more than 11 telltale signs, basic signs, that lead a doctor to perform a celiac, wonder if you are celiac. And in doing so, those signs are poor appetite, bloating, gas, abdominal pain, constipation, seizures, numbness in fingers, toes. It could be at any point. Weight loss, irritability, mood swings. And there are a list of other things, but when they ask you, these are some telltale signs. And once this is performed, then the doctors will actually decide if they want to do a colonoscopy and possibly even an endoscope, which basically are biopsies to check your small intestines and see what the process is. If you do have that, if I pronounce it right, it's celiac, and then they go from there. There is a blood test that you can take, but it's not 100% compared to a biopsy. So in my conclusion, celiac disease left unaffected causes damage to the small intestines. It is linked to several other health issues. One of the biggest ones is cancer and the lack of nutritional value. And it's not a different diet. It's a different diet, but it's not a diet. It's not a fad. It's life-changing. It's an altering life, way of life at this point. When someone has celiac disease, they have to change everything about their life, from reading every ingredient to not eating out anymore, basically. Majority of the restaurants are not designated for someone that has celiac disease. It might say gluten-friendly, but it's not cross-contaminated friendly. There's only a handful of restaurants out there. And the reason being is they're not educated in celiac disease. They're not educated in what really is gluten-free. A lot of people think that gluten-free means no cheese or no yogurt or other items. Celiac disease it's actually can be a killer if untreated. And just an example, for someone who has to deal with this on a daily basis, and people say it's just a fad, they just want this or that. I used to love McDonald's. I used to love Pizza Hut, thick crust, and so forth. I was that person who weighed 200 pounds and could not get the weight off until after I found out I was celiac. And then once I found out I was celiac, the weight just came off. Now, granted, I've gained some now. My daughter says that, you know, it's because you're in love again kind of thing. But I don't like the prices. So, and when I say that, people with celiac disease, they don't eat it just to be on a fad. I have gloves on, and the reason being is I'm so allergic, not just to gluten, because it's not an allergy, but also to wheat, that if I even touch it, I will break out in a rash. And I have to carry an EpiPen because my throat closes up. So, an example, this is my gluten-free bread. This is the size of it. I pay $7 for this loaf of bread, which gives me usually about 9 pieces of bread. This is my husband's bread, and he pays 88 cents for it. So, in my conclusion, or the end, just remember next time that someone says I'm celiac or I'm gluten-free, ask them questions, because celiac is not just a fad. It's a serious disease. Thank you for listening.